After surgery or radiation for head and neck cancer, swallowing and talking are now things that may be difficult to do. Surgery and radiation can weaken and tighten structures that affect swallowing and speaking, including the tongue. My name is Kelly. I am a physical therapist and I specialize in oncology and lymphedema. And in this video today, we're going to go through and share different exercises for the mouth, for the tongue, and to help with swallowing that someone can do after surgery or radiation for head and neck cancer. This video is part 2 of a 2-part series, and in the first video I went through different exercises for the jaw, for the neck, and for the shoulder. So if that is something that you're interested in, you can check out that video up above here. But otherwise, be sure to subscribe down below for weekly new videos. You can also check out different resources on our website at cancerrehabpt.com, and you can follow along with us on Instagram for more related content. After treatment, swallowing can become a challenge because if the radiation affects the salivary glands, then you're not going to produce enough saliva, which can cause mouth dryness and make it really hard to swallow. If the muscles of the tongue are affected, then they're not going to be able to help to guide fluid and food down your throat and your esophagus. And you also may have weakness of the muscles that protect your airway. And so if they're not working correctly, then there's the potential that food and liquid can go down the airway, and that can also be a major problem. So these are the exercises to help strengthen these muscles and help maximize these muscles. They can all be done for 10 repetitions, 2 to 3 times a day. But before you begin, you always want to make sure that you get clearance from your doctor for safety, and you work with your physical therapist or speech language pathologist for more personalized guidance. So first, we're going to work with the tongue range of motion exercises. For the first exercise, we want to stick the tongue out as far as we possibly can until you feel a really good stretch in your tongue. We want to hold this position for 5 seconds. And then we want to pull the tongue as far back into the mouth as possible, such as if you're like yawning or gargling something. We want to hold that position for 5 seconds. You can go back and forth repeating this exercise 10 times. The next exercise with the tongue is to try to stick the tongue out towards your left side, again as far out as you possibly can till you feel a really good stretch in your tongue. Want to hold this position for a good 5 seconds. And then you're going to move your tongue out to the right side as far as you can, feeling a good stretch in your tongue, and holding this position for 5 seconds. And you can go back and forth, left and right, holding each for 5 seconds, and doing this 10 times. The last exercise for the tongue, you'll stick your tongue right behind your top teeth or at your gums, and holding your tongue in that position, try to open your mouth as wide as possible. Hold this position for 5 seconds. And then you can relax. And you can repeat this exercise 10 times. The next exercise is for your lips and your mouth. You want to purse your lips out as far out in front of you as you can, kind of like you're blowing out a candle. Hold this position for 5 seconds. And then after 5 seconds, you're going to pull your lips in, pulling them back into your mouth, and holding this position for 5 seconds. Go back and forth between the 2 movements 10 times. So the next few exercises are for swallowing. The first one, we want to put our tongue gently between our front teeth. Holding our tongue in this position, try to swallow. Then relax. You can relax your tongue in between, but put your tongue again between your teeth, gently holding your tongue in this position while you swallow. And you can repeat this 10 times. The next exercise is also for swallowing. And so what you're going to do is you're going to swallow as you normally would, but as you feel your Adam's apple rise back up, pause for 2 to 3 seconds before you allow your swallow to fully relax. If you have a difficult time with this, you can look in a mirror and watch, or you can even gently put your hand on your throat area to feel that rise. You can repeat that exercise 10 times. And for the last exercise, we're going to be laying on our back or on a bed, and you can have your knees bent up for comfort for your back if needed. You're going to lift your head up, looking down at your toes, and then gently put your head back down. And those are a few of the exercises for strengthening of the mouth, the tongue, and for swallowing exercises after head and neck cancer treatment with surgery or radiation. Again, always get clearance from your doctor before starting, and you can work with your therapist or your speech language pathologist for more personalized guidance. You can also be sure to check out the other video in this series for jaw, neck, and shoulder strengthening. And if you have any other topics that you want to see covered in future videos, be sure to comment that down below. But we'll see you all next week in another video. Thanks, everyone.